that, oh, thanks, Ben. Now recording this program. And then we're going to be doing some introductions of the people that we're going to be bringing this new program to you. We're then going to have Jacob from GRAVIE give us an idea of what kind of program we're going to be seeing today. And then we do have one member who has going to be willing to share their experience with us. A couple housekeeping things is that this is a meeting, not a webinar. So usually in webinars, we automatically mute you. You're not automatically muted now. And so if you'd like to put yourself on mute until you have an opportunity or you want to share or ask a question, please do so. We might mute you ourselves if we're finding any background noise, so watch for that, please. And if you're welcome to chat in a question as well. And of course, we'll share it with our leaders today and to make sure that it gets answered. If you didn't find your question to be answered, please just drop me a note and we'll make sure that it gets answered post-meeting. So the background to why we're here today is that PIM launched with our partners at Holmes Murphy a PIM Health Plus program a couple years ago, and we brought on a partnership with UnitedHealthcare. We had a number of you, I think, on this call and others attempt to make that work for themselves, and we just didn't find that we were getting the kind of program that made a difference, enough of a difference for you to make a switch. Over time, we have come to know this new opportunity, GRAVIE, and I find it very exciting. We already have a few members who are already part of their team and are really finding it to be an excellent opportunity for cost savings as well as even adding employee benefits. So there's no more important thing right now than maintaining our current workforce and recruiting the next generation workforce. We hope that this is going to be one of the pillars in your arsenal to be able to do just that. Going to introduce Drew Engebrecht from Holmes Murphy and Alex Sandvig from Holmes Murphy. They have been our partners throughout this process. They're very committed to the print industry, and I think we're all the benefit for it. And then Jacob Barenbroek, I know I didn't say that correctly, I apologize, from GRAVIE, who will be providing the overview of the opportunity. Drew or Alex, anything you wanted to say to start?
Yes, thank you so much, Steve. First of all, it's been a great partnership over the years, and as we began that, we indicated that we're going to do everything to make sure to put the right benefits in front of your members and potential members. So we're really excited about this. Our partnership began with GRAVIE in the last year or so, and we've been thoroughly impressed with how they think and what they can bring that's different. We certainly understand, you mentioned the job market, Steve, but, benefits, health insurance itself, it is incredibly complicated and it's incredibly expensive. So in the end, our job is to help you and your members save time and money. And we're excited, we're hopeful that a program like this can do this. One other piece that I think is different than the UHC program in the past, it was very siloed. It was mostly for groups under 100 and just in the state of Minnesota. We're excited that this program is available to all of your members of any size and all of your locations. So we've been working a lot with GRAVIE, and we won't steal any thunder because we love the way they think. We love what's different because we don't see this in the marketplace. So Jacob's going to walk and go through really what does make them different and how the offering through PIM is something a little special as well.
Great, thanks, Drew. Appreciate all your support. Jacob, I'm going to stop sharing now and turn it over to you. Fantastic. So, Jacob, welcome. We're looking forward to your presentation today and looking forward to working with you in the coming months and years.
Yeah, thank you, guys. Steve, I appreciate the introduction. Drew and Alex, thank you both for looping me in. Are you guys seeing this okay, or am I maybe need to flip
it looks like we're seeing
There you go. That's
Yeah.
better.
Let's see here. Just when I get a new computer, this is what happens to me. Let's see here.
You can swap displays.
Yeah, that's what we'll do. Presenter view. Sorry about this, guys.
Up there.
There we go.
There you go.
All right, appreciate it.
Yep.
Thanks for walking me through that, Steve. Yeah, no,
Okay.
as Drew had mentioned, we've just had a really great partnership with the Holmes Murphy team over the past year and a half now. We've been really excited about the growth that we've had due to that partnership. And when we've had the opportunity to work together on a couple of PIM members this past year, we started having a little bit more conversations given the success we had with those initial groups, and the ability for Gravy to be a little bit more flexible and be able to offer something that's available to maybe not PIM members just in a specific location, but really across all locations where PIM members are located. And then we were also able to provide a couple of wrinkles with this offering that you won't find out elsewhere as well with other groups that are working with Gravy. Just a quick little background on Gravy. Headquartered in Minneapolis, we're founded back in 2013. Our leaders of our team and our founding team at Gravy have been within healthcare spend over the past really 20, 30 years, have founded other businesses within that space as well that have been very successful and have always been really pursuing the mission of improving the way people purchase and access healthcare. Now, Gravy does, as I mentioned earlier, we do work with employers nationwide. We have over 1,500 employers working with Gravy to date. Very heavily Midwest focused, just given we're headquartered there and we're founded there. So Minnesota, Iowa, the Dakotas, Illinois, so Nebraska, those are some of those kind of core states for our business today. We're excited about continuing to kind of expand across nationwide. But again, as I mentioned, this offering will be available to all members across PIM. Now, what Gravy really did and how we're doing things a little bit different, I think it always helps to start with, why are we doing what we're doing today and how did we come to where we're at in making this sort of offering? And so we really took a step back and wanted to look at some of those kind of core problems that you see with traditional health benefits today. A couple of those showing here being cost, of course, right? We're all looking for a way to either reduce our costs or at minimum, maintain what you're paying today and try to avoid some of those increases that you see year after year. Really a big one being the lack of benefit that the majority of employees receive with their traditional health benefits today. You can see there 90% of the employer spend goes to benefit less than 10% of the employees. So really what we were seeing was those that maybe were a little bit more unhealthy, had some issues, of course, those are the ones that are going to be able to benefit from having health benefits, but where does that leave the majority of that employee base? The other being that low perceived value. So as some of you may be familiar, or maybe you're experiencing this today, there's been that continued shift towards that high deductible, high out-of-pocket max health plans, leaving really employees feeling like benefits at times weren't even worth having because one, they just weren't receiving really the benefit in their everyday services, but they also weren't ever reaching maybe that deductible or that high out-of-pocket maximum. That just wasn't a number that they're hitting. So at times, where's the true benefit coming in? And then also, as I mentioned earlier, improving the way people purchase and access healthcare. That's always been a mission of Gravy. So that low satisfaction that you see from just as a whole and within the health insurance industry. So Gravy wanted to address that and really create a health plan that was much more simple and easy to understand, which brings us to Comfort. Comfort is really the first of its kind health plan that brings value to employees across the board and brings first dollar coverage to all employees day one. What you're going to see out of a comfort plan design is that there are 0 deductibles, which means there's also no co-insurance. There are 0 copays on the most common healthcare services. And you'll see here in a moment what we're categorizing as those common healthcare services. But the other thing, as I just kind of alluded to on that last page regarding low satisfaction, is we wanted to remove a lot of the confusion that comes with health benefits as well. We wanted to encourage employees to really be able to go out and get the care that they need. We didn't want them feeling frustrated about, okay, I'm paying a copay, and then maybe a couple of weeks down the road, all of a sudden I'm being sent another bill. The frustrations of I'm hitting a deductible, all of a sudden I'm paying a percentage, I'm having to hit another number, just that kind of confusion that comes with that everyday use of health insurance. We really wanted to simplify that as well. So you'll see here from a plan design perspective, and note that everybody will receive this same plan design across the board. So here you'll see 100% coverage on those common healthcare services. And what we're considering there is as no cost services, primary care, preventive care, of course, as it is today. We're also talking about specialty visits, urgent care, labs and imaging, generic prescriptions, and online care, which is through MD Live 24/7 support. So again, as you're seeing this, really that kind of nickel and dimed experience that you might get in traditional health benefits today, where every experience that you have with your health insurance, you're having to pay something. Here at Gravie, we really took a step back and said, let's provide a lot more value across the board to all employees and not just kind of that 10% that we talked about earlier. So again, common ones, labs and imaging, generic prescriptions, online care, specialty visits, urgent care, primary care, all of those are at no cost to the member. Now, there are a couple of copays there you see, being the emergency room, brand name prescriptions. You have the ability to offer a copay for specialty prescriptions as well. All of those copays do go towards the out-of-pocket maximum that is going to be selected by the member there. Now, what goes towards the out-of-pocket maximum? What's the catch? Where do some of these costs come in? So the costs that the member is responsible for are those inpatient stays, surgeries, hospitalizations. For example, my wife, we had a child over the past year. The costs that we were responsible for were that delivery, as we were at the hospital, any of those costs, all those costs were going towards that out-of-pocket maximum. Now, everything leading up to that, the bi-weekly visits, just checking to make sure everything was okay. All of those came at no cost leading up to that time frame. So again, more of those maybe uncommon items or items that you're typically looking to likely be having spend towards in a traditional plan today. Those are the type of items that will be going towards an out-of-pocket maximum. Now, in regards to how many out-of-pocket maximums you might have as a choice, that's part of kind of the exploring process that we'll do up front. We'll gather a lot of the information as to maybe what you're doing today, provide you maybe similar options in terms of an out-of-pocket maximum. We can also work with Holmes Murphy, of course, during this process, really determine what out-of-pocket maximums might be best fitting for that particular business. You can offer 1, you can offer 3, you can offer 4. So there's different levels of out-of-pocket maximums. Now know that those go as all the way down to maybe a $500 out-of-pocket maximum for a single, all the way up to a $7,900 out-of-pocket maximum for a single. And then there's, of course, a number of ranges of out-of-pocket limits that fall in between. So know that the plan design will stay consistent. Everybody will receive the same plan design. The only thing that might be different is potentially the out-of-pocket maximum that employee potentially chooses based on what's being offered to them. Now, the other thing to note here in regard to plan designs, if there is an HSA plan design that you maybe are offering today and you want to continue to allow your employees to be able to utilize that type of benefit, we do have HSA plan offerings that do have more of a traditional look that we can pair with any of these comfort plan options as well. Just a couple of examples that I think kind of help bring to light where one, there aren't those hidden costs. You're getting that first dollar coverage, and two, there aren't any surprise bills that I kind of mentioned earlier. So you see here, for example, Emma hurts her ankle as she's out for a run, goes to visit a doctor and for a checkup, and then has an X-ray. She's sent down the hall maybe for an X-ray. As you know, in traditional benefits today, you're paying a copay. Maybe you thought that, hey, I paid my copay, go home, you know, a couple of weeks later, you're being dinged with a bill for that X-ray. In a traditional plan today, you're usually paying around $250, $450. That's a no-cost service through Comfort. Here you see Sue's taking a generic prescription daily. You may be spending $300 to $500 annually on that prescription through Gravie. That will be at no cost. Again, similar example as kind of the first one, right? You go in, feel a little bit under the weather, head to the doctor's office, and all of a sudden you're being sent down the hall for some blood work. Again, that might cost you $100 to $300 on a traditional benefit. But here through Gravie, you're receiving that as a no-cost service. So again, just some common examples. Others that come to light, maybe you have ongoing visits with a mental health therapist. Let's say somebody's going through remission for breast cancer and needs to go to the clinic, have a diagnostic mammogram. That would be at no cost to that employee. Another one to mention as well is chiro. So chiropractic visits are also at no cost through Gravie Comfort. Those do have to be medically necessary, not something you're going to just as kind of a fun service. They do need to be medically necessary for that chiro visit to be at no cost. But again, just a couple of benefits and kind of common examples that come to light often that typically you'd be having spend towards in a traditional health benefit plan, where through Gravie Comfort, again, that'll be at no cost to you. A couple other things that you're seeing with Gravie and our offerings. Gravie does have a benefits platform, which can be made available to, again, all the groups, regardless of size. Here, it's an enrollment platform, but it's also a platform for employees to use throughout the year if they want to get an online ID card, if they want to check to see what doctors are within network, what prescriptions are covered. All of this is made available to employees. It also can be used throughout enrollment. If maybe you don't have something like this in place today and you'd like to utilize more of an online platform, we can definitely make this available to your team. Maybe you do have something in place today. That's no problem. Gravie does integrate with other payroll and benefit platforms as well. So we can make sure that you have those plan designs built in for your enrollment process. So again, really wanting to make this a seamless experience for you, not cause any additional administrative responsibility, really allow for this to be a flexible process, and we're open to whatever works best for your business. Another thing maybe you're not seeing today is, especially if maybe you're under 100 employer and are fully insured, is Gravie's offering monthly reporting on the performance of your plan. Maybe you want to add employees, new employees, that's available there through our platform. You can see where your enrollment stands at. You can see maybe which type of plan offerings employees are enrolling in, which type of out-of-pocket maximum. Where this also becomes helpful is we can help really improve the utilization of the plan. Maybe we see there's been some employees that have gone to the emergency room a couple of times where maybe they've just forgot that urgent care is an option and that's at no cost. So we can maybe start to help educate the members a little bit better. Maybe an employee is paying for a brand name drug today where there's a generic prescription that would be at no cost that we can talk to them about being maybe a viable option. Again, just ways to help improve the plan, but also improve the experience that your members are having as well. And again, this is the type of reporting that you can receive on a monthly basis. So again, you have up-to-date understanding of how that plan is performing throughout the year. A couple of just really highlights that I wanted to provide to you that I think you can see both from an employee level, but also the employer level as well. I've mentioned a few of these already, being we wanting to remove a lot of that confusion that comes with traditional health benefits today. It's a very simple plan design. We wanted to encourage employees to have better access to their health insurance and also provide a lot more value by covering those common healthcare services at 100%. I think what this is also doing is promoting better health outcomes. We don't want, again, employees to feel discouraged, whether that be because they're confused about accessing their health insurance or because they're not wanting to continuing to have to pay for each and every single one of these kind of standard visits that they might have. All of a sudden, they've let something linger and they're one, in worse health, and two, having to pay a lot more out of pocket towards something that, of course, has gotten worse over time. I mentioned that smart tech platform that we're going to be having available. GRAVIE uses broad national PPO networks. And so depending on your location, we will be looking at Preferred One, Aetna, or Cigna as your networks. And those are on their most broad national PPO networks. I'd say standardly, we're looking at Preferred One for the Minnesota members. That does include Mayo, so does Aetna, so does Cigna. Mayo will be included in all of these network offerings. Again, these are on their most broad national PPO networks. And part of the reason for us partnering with those networks is we wanted to cause as little to really no disruption when it comes to the providers and facilities that you're seeing today. We wanted to make sure that those are all the same, I guess, access points that you're able to continue to see today. And then Gravycare, that's really a big piece of our business that I'd like to kind of highlight for you here briefly. So Gravycare, what that is those are licensed health insurance professionals. They're advisors that sit out of our Minneapolis office. About 60 of those members of our team are advisors. They're there to assist employees throughout that enrollment process. So really advise them as to which plan might suit themselves and families best. But then they're also there to really answer any plan related questions throughout the year as well. So again, some of those common ones: who's in my network, prescriptions, if they have the claims questions, billing, really any of those plan related questions can go to that Gravycare team. And a big reason for us setting this up is, one, again, we wanted to really continue to improve the experience that the employees have with their health insurance, but we also wanted to really offload a lot of the administrative responsibility that might fall on the employer's plate. Really, GRAVIE was built for that kind of small to mid-size employer back in 2013. So we wanted to do as much as we could to offload any and all administrative responsibility, which has been a really key piece of our business as we've continued to expand and continue to kind of expand our target audience. It's been a really nice service to be able to provide to both the employees, but of course, kind of have that trickle down effect where we're able to answer a lot of those questions that might come to the employers today. From an employer perspective, and a couple of unique things that we're doing with PIM members specifically. So GRAVIE standardly has around 15 enrolled as a minimum number of lives. Now with PIM, we wanted to, with this being a broader offering to this association, what we really wanted to do is reduce that minimum requirement to 10. So if you have 10 employees that are able to enroll in your group health offering today, you are eligible for this comfort offering. The other thing that we wanted to do, which is unique to PIM members, is offer 2-year rate caps. So one thing we wanted to do is, as we were building out this program with Holmes Murphy and as we were talking with Steve, we wanted to really make this as a unique offering and something that we wanted to promote in terms of long-term value and a long-term commitment to you as members, and of course the partnerships that we have with Holmes Murphy and PIM as a whole. And so you'll see with any proposal or quote that we're sending over to you or that's being presented to you by Holmes Murphy, there will be a 2-year rate cap that's being offered within those proposals as well. Again, I mentioned the networks that we're going to be utilizing with PIM. Steve talked a little bit about this earlier as well, retaining, attracting top talent. I mean, this is a plan benefit offering that you're not going to find anywhere else. And I think really you put this in front of anyone and they should say, yes, I can see the value here that I'd be getting from this offering, and please, where do I sign up? And that's what we're hoping you're getting as a membership. Again, I mentioned the reporting. There again, high client retention rate. Just wanted to mention that as well. Gravy does have a 97% retention rate for groups that have transitioned to Gravy. I think that one speaks very highly of the way that we're able to price our groups and offer our quoting process. And then also too, just again, the experience, being able to take care of both the employers and employees, both make sure that they're really getting that handheld experience and getting the attention that they need. How can I receive a quote? I thought it'd be nice just to kind of mention this before turning it over to, I believe, Joan, who's going to be talking a little bit about their experience working with Gravy. Please reach out to PIM representative, reach out to Steve, reach out to the Holmes Murphy folks. We're happy to help as well. How we go through the quoting process. These are underwritten quotes, and so we will be requesting either claims history if that's available or medical questionnaires. This is all information we can of course dive into a little bit more detail as we start exploring this offering for your particular group. And so with that, I see that we had a question here. Are there options for employees with less than 10 employees? We do not have a particular group offering for Comfort, this specific plan design for groups under 10. I'll allow the Holmes Murphy crew maybe at some point to share if there's some other things that they may have in mind that they'd be able to offer them outside of maybe Comfort for groups that are less than 10 employees. But with that, I think I will stop sharing my screen and turn it over.
Fantastic.
And I'm happy to answer more questions here as we get towards the end, as long as time allows.
Absolutely. I'm sure we will have more questions as we go. I wanted to bring Drew or Alex back on, along with Joan, if you could unmute and just let everybody know who Joan is. Joan is with Ideal Printers, and Ideal is one of our longest standing members, a great partner with participation on the board and going back many years. And Joan has been a big supporter as well, and she's with us here to share a little bit about Ideal's experience with Gravy. And maybe Drew, if you might want to discuss that with Joan, since I think you were integral in supporting her in moving their company onto Gravy.
Yes, thanks, Steve. I hope she says the same thing. No, we did get connected with Joan and Ideal through the PIM relationship, and we had a great call. Just like many others, they were struggling with high increases and really satisfaction with benefits. So at that time she kind of said, we're open to anything. Let's scour the market. Let's look at something different. And as we were just beginning our relationship with Gravy, Alex and I had our discussion and said that this screams Gravy. If you want to look at something that's different, beneficial to your employees, and hopefully low cost. And they did come through, and I won't steal her thunder, but when going through the process, I think it worked out really well, and I think it was received really well. So again, wanting something different, wanting something that was not complicated and saving money, that's how we really got to this point. And again, I won't steal thunder. We'll see if Joan agrees with me and can give any more color around that.
Awesome. Thanks, Drew. I agree with you on all accounts that you guys talked about. 2021 is our first year working with Holmes Murphy and with Gravy, and it has been an overall fantastic experience. We had been with a benefits broker for at least 15 years prior. It's not an easy decision to jump. when you've got a longstanding relationship like that. But we just had a good feeling from the start, and we talked to Holmes Murphy, thanks to the PIM introduction. And yeah, I think that the big message we brought to that first meeting was we need to find some savings. We were up for a pretty significant increase with our previous carrier. We told our previous benefits broker the same thing, like, think outside the box here. You know, we really, whatever you can do. And Holmes Murphy came up with the GRAVIE option, which, you know, just looking at the dollars, seemed too good to be true. And then when you hear the benefits to the members, it seemed too good to be true, but it looked really good. And our other previous carrier did come down in their increase significantly, but it was still an increase. Moving to GRAVIE, we saved $65,000. So no increase, we actually saved $65,000 between the company and the employees. Company covers about 70%. So that was about $45,000 to our bottom line. Huge. And the whole process was just really positive. The Holmes Murphy team, Alex, Drew, and Julie, and the GRAVIE team did a great job. Julie from Holmes Murphy and Jessica from GRAVIE presented at an in-person, couple in-person benefits meetings. I think it was their first in-person since COVID probably, and ours too. So we made it remote as an option or in person, so we didn't have too many people in the room at one time. That worked out really well. And, you know, I put out an email to our entire team to say, you know, if you guys have feedback, I would really love it to bring it to this meeting. Good, bad, indifferent, any kind of feedback experience you've had. Because I could really only speak for my personal experience. And I didn't get any negative reviews. And normally it's the negative stuff that you hear about. But I've got many positive reviews. People overall really have enjoyed the shift to this GRAVIE comfort plan. Holmes Murphy and GRAVIE pulled together an option for us where we've got 3 out-of-pocket maximum options to choose from, where each member can choose, you know, their maximum out-of-pocket, which is going to impact the premium that they pay per month. And so it was good to give them.
Yeah, we're breaking up a bit.
Okay. Can you hear me?
Yeah, I can hear you.
Better?
Yep.
But anyway, I'm trying to see if I can tell what the options were. Out-of-pocket max from $3,500 to $6,000. And that really lined up favorably to our previous traditional plan. So those seemed pretty palatable. And then we kept the traditional HSA as an option. About half of the people that were on HSAs stayed on an HSA with GRAVIE, but many thought, I'm going to give this max out of pocket a try because there are so many things, virtually everything that's not a pretty intensive hospital visit or procedure is going to be covered. And surprisingly, you know, people are not having any kind of out-of-pocket payments in large part. You know, everything that the GRAVIE plan says they're going to cover at 100% they have, as far as our experience or any experiences that I've heard about. Eye appointments, a lot of prescriptions people are surprised at, no copay where there previously was a copay. Now I'm sure there are some that are, you know, specialty drugs that are probably similar to where they were before, but in general, I've heard good things about prescriptions, eye appointments, any kind of preventative, chiropractic, therapy visits, all covered. Dermatologists, MRIs and scans, 100% covered. You know, I've heard you kind of have to look about where you're making that appointment. Be sure you might want to verify that. And Gravie will help walk through that. Gravie provided a dedicated customer service person to our team, and that was really helpful, especially at the beginning where people were trying to decide what's a fit for me. They could kind of talk through what is your typical healthcare needs. That I thought was really cool for HR to be able to give the name and a phone number of a direct dial help. So we didn't need to be fielding a lot of those questions ourselves. I think my assumption is in the big picture, we're gonna have a healthier team because people are not afraid to go to the doctor. I think historically, even if you're going to your annual physical, a lot of times there's nickel and diming that happens. This doesn't fall under, there was blood work. There's going to be a charge. Blood work is all covered. So I think big picture, people are going to go to the doctor more often and check things out and deal with issues before they become bigger issues. I've heard no network complaints. Our network is preferred one. Mayo Clinic is in the network. Trying to think what else I should touch on. Yeah, I think there was one instance that someone shared where there was a colonoscopy procedure that was not preventative. It was a diagnostic procedure that was out of pocket because there was anesthesics. So they didn't qualify for 100% pay. So that was the one item that came up that was out of pocket that I heard about. But overall, people are loving it.
Great. Thank you, Joan. That's terrific. I think you offered some more details than I even thought you were going to. So I really do appreciate that. I think sharing your rates is helpful for people to hear. I think one of the things that I heard that really importantly from a benefit perspective is that your employees you think will ultimately be more healthful, and they're going to actually become less afraid to go to the doctor for fear of out-of-pocket expenses. I just think you can't look at that any other way than that's an amazing statement that I think can ultimately make a big difference for all of us in our communities.
Steve, I 100% agree. And I tell you from a big picture perspective, you may know this, maybe everyone doesn't, but Alex and I are nice guys. We got into business where we have to deliver bad news a lot. And the direction we usually get is, I want better plans and lower rates. And, for years, there's nothing we can do about that. Now with this option, we have been able to bring that to many customers. Again, it's not going to be everyone, but there at least is that option that we can improve benefits and lower costs, which makes our day. We're used to the opposite.
Thanks, Drew. Jacob, any words you wanted to follow up with based upon Joan's kind of feedback, as well as maybe some of the questions that you've been hearing through the chat.
Yeah, I don't. One, Joan, thank you. I appreciate you sharing your sentiments. I think it's always nice for me to hear how things are going. I know that you work a little bit more closely with our service representative, but I'm happy to hear things have been going well and the plan has been performing the way that your employees have expected and as it was advertised. I think that's the big message here. Is a lot of the times people might take a step back and say, this is too good to be true. I'm going to go to the doctor. They're going to charge me for something. I'm going to be frustrated. That hasn't been the case with groups that have transitioned to Gravie. I'm happy to hear that's, of course, been the case for you as well. I am seeing some network questions that are kind of coming through. Preferred One has been just a really awesome and easy and broad network for us to use if we're talking about our Minnesota employers. I'd almost say that anyone and everyone is likely going to be a network. One thing I will mention with, and I saw there was a question on, who's the carrier, who's the TPA. Gravie does own the stop loss, so we are the stop loss carrier. We do administer all aspects of this health plan. We are the TPA. One thing that kind of ties in with being the TPA and the network is if we're ever finding, this goes for all locations, if we're ever finding there might be a particular physician, specialist, clinic that may be showing is out of network. We do have some workarounds as being the TPA to build in network benefits for some of those employees. So no, from a network perspective, we do everything we can to make sure, again, that there is no disruption there. But all really great questions, and I'm happy to answer any others that might be out there.
Yeah, and this is Alex. The only thing that I'd like to just kind of add before we close up and finish up questions is Drew and I and Jacob would love to hear from all of you, regardless of if you're up against a tough renewal or even getting a good renewal from your carrier. One thing Drew and I have been very impressed with working with the underwriters at Gravie is they're truly looking at the risk inside of your population as it stands today and looking at that moving forward, where most traditional carriers are going to look back, 24 months and they're going to try to rate for things that aren't even on the plan anymore. So, just to kind of wrap things up, even if you get a good renewal or you're up against a tough renewal, we'd love to show you an option with Gravie, for all the reasons you guys heard here today. So thanks for joining, and we'll open up to last minute questions.
Thanks, Alex. I have put up the contact information for everyone to be able to reach out to the Holmes Murphy team or directly to Jacob. So you have their emails, and I see if there's any last minute questions that we haven't addressed.
I guess I'll just say I agree to Alex's comments as well. We take a very forward-looking approach. We don't want to penalize you for any past claims that may no longer be existing going forward, or maybe those are improving, and we want to take that into consideration. Again, I think good, bad, or indifferent on the type of renewal that you're getting, I think it's always a good opportunity to have another option out there. And I think what you'll see with Gravie, of course, as well is, one, we're hoping, and the goal is to provide you savings on your premiums, but there will be those savings throughout the year within the plan design that your employees will be seeing, as well as they won't be having those copays that you'd see in other traditional benefits.
Thanks, Alex. Jacob, do the out of network amounts apply to the out of pocket maximums?
Great question. So how out of network works is there's a out of network deductible. Those are at, so as a single, the out of network deductible is $10,000. For the family or dependents, that's at $20,000 as a deductible. There isn't an out of pocket maximum for out of network. Now, a couple things to note there. We don't see very many out of network claims come through. If we ever do, we make sure to get in front of that. And I think that's part of our just kind of member experience that we provide is we want to start reaching out, making sure that they understand, one, that was maybe an out-of-network benefits. Let's kind of get them back to in-network utilization. Others being any emergency circumstance will always be considered as an in-network benefit. So know if, God forbid, you got in a car accident and you're in rural Alabama, let's say, and you go to an out-of-network hospital, know that that will be treated as an in-network benefit because of it being an emergency. So we don't see many out-of-network benefits actually come through. And of course, pair that with kind of the broad national PPO networks that we're working with today. We want to make sure that there's always likely going to be an in-network option for employees.
Great. All right, well, thank you everyone for participating. I really appreciate it. I'm excited about this. We're just getting underway. I'm hoping that you'll all look to receiving a quote for your companies by reaching out to one of our partners here. If you have any questions, send an email directly to me or give me a call. This meeting has been recorded. We'll be getting it out to all the registrants and for those that couldn't be here today. And then I'm sure you'll be hearing a follow-up from Drew and Alex directly, so you can connect with them ongoing. So Jacob, thank you so much. Really appreciate your time today. Looking forward to working with you. Joan, really appreciate your sharing so clearly. And Drew and Alex will be speaking to you soon.
Thanks, Steve. Thanks, everyone.
Thanks, everyone. Take care.
Thanks.